Hey everyone, it's Tuesday, and I've got 3 immigration stories to share. Grab a minute, take a breath, and let's get into what's actually changing for people right now. First, ICE detention. Conditions are getting tougher and more crowded, and there's been a big jump in solitary confinement. Officials are scaling up capacity from roughly 56,000 beds to more than 100,000 after a major funding bill back in July. That's a huge leap. People inside are reporting harsher treatment and growing suicide risk. Here's what that really means. When facilities fill up fast, staffing and medical care often don't keep pace. And solitary, being kept alone for long stretches, can intensify anxiety, depression, and self-harm risk. If you have a family member in detention, check whether the facility has a grievance process, whether they can access mental health services, and whether an attorney or accredited representative can visit. None of that fixes the larger policy choices, but it can help someone hold on to stability while they're inside. And if you or someone you know is struggling, please reach out to local crisis resources right away. Support matters. Let's talk about deportations to Ghana. A judge has refused relief for a group scheduled for removal, saying options are limited as expulsions ramp up. During the week of September 5th through the 12th, 14 people were sent from Alexandria, Louisiana to Ghana, and the group reportedly included Nigerians and Gambians as well. Ghana's president has confirmed a deal to accept deportees. Critics say some of those people believe they had orders that should have paused removal, and there were reports of poor conditions at holding sites. Quick explainer: a stay of removal is basically a pause button on deportation. If that pause isn't granted or runs out, ICE can proceed. This raises hard questions around due process. Did people get a fair shot to present their case? And around safety, including the risk of torture or mistreatment once they're back. If you're advising someone at risk of removal, timing is everything. Getting a reputable lawyer to review paperwork and file any last-minute stay requests can be decisive. Even then, results can hinge on how a judge reads the law and the facts. There's also a story out of California hospitals that's getting a lot of attention. Nurses have been pushing back on ICE presence in medical settings, saying it harms patient care and erodes trust. The moment that really lit this up happened in July at Glendale Memorial Hospital, where agents reportedly waited on site for 6 days for a patient. Think about the effect. People delay care when they worry about immigration enforcement, and that makes outcomes worse for everyone. Nurses and patient advocates are asking for clear rules that put care first, protecting privacy, keeping clinical spaces calm, and making sure the bedside is not treated like a checkpoint. Hospitals often have policies against non-urgent enforcement in treatment areas. The call now is to make those rules clearer and consistent so staff know exactly how to respond. All 3 stories connect in a simple way: where and how enforcement shows up. Inside detention centers, on deportation flights, or in hospital hallways shapes people's safety and dignity. Bigger detention numbers constrain care. Fast-paced removals press the limits of due process. And agents in clinical spaces can chill the trust that keeps people healthy. We'll keep tracking these threads and the practical details that affect your life and your work. For deeper coverage and updates, I'm reading everything at visaverge.com. Thanks for listening, take care of yourselves and each other, and I'll be back soon.